Fentanyl. It could be hiding anywhere, including in your house, including in your medicine cabinet, or maybe at a friend's house when you're hanging out, playing games, and get offered a pill. Don't take chances. If a drug didn't come from a pharmacy directly to you, you can find fentanyl using a simple strip you can pick up at your local pharmacy. Don't take it until you test it, because fentanyl can be hiding anywhere. Brought to you by the Georgia Department of Behavioral Health and Mental Disabilities.
When you think about the future you want to create for yourself over the next few decades, what resources do you need to be able to build the life you want? Are any of them more vital to the creation of your future you want than a high-functioning and energetic mind? You're listening to the Health Courage Collective Podcast, episode 135, Boost Your Brain Energy. Welcome to the Health Courage Collective Podcast, the show for women who are too busy to slog through hours of generalized, inapplicable, and often contradictory health information, but too smart to ignore that a few minutes of focused attention now can prevent years of suffering in the future. I'm your host, Christina Hackett, a pharmacist who doesn't want you to live on prescriptions, a certified coach specifically trained to maximize your potential, and a compulsive learner obsessed with preventative, cutting-edge, holistic, and integrative medicine. I'm on a mission to increase your physical and mental resilience so you can fearlessly look forward to your next 40-plus limitless years. Your time is now. Let's go. Hello, my friend, and welcome to the podcast. I hope you are doing so great on this last day of January, or whenever it is you're listening. How are the villains in your life? Are you appreciating their role in carving you into a stronger and more resilient you? A you who's better prepared to conquer the next 30 years of life than you would be without them? Yeah, take that, annoying coworkers, Big Pharma, and Beach Ken. Today we're going to talk about what I think is probably the most important resource for you to maintain and hone and enhance, which is the functionality of your mind. This is a vast topic that could go all kinds of directions, all of which I find very fascinating, but today I'm steering us in the direction of what I think is one of the most important books of the decade. We'll get to it in a second. First, let's talk about nuns. Nuns are kind of awesome, don't you think? They might break into song about their challenges solving a problem like Maria, or come on a bicycle to deliver your baby in London's East End. Not to mention all the awesome stuff that they do in real life, helping people who can't help themselves, etc. They're also ideal research participants because you know where they're going to be, and they live pretty controlled lives that are pretty similar to their sisters in the same convent. As part of a larger study, researchers at the University of Kentucky decided to retrospectively review and analyze the entry statements of newly appointed nuns, mean age of 22 at the time of the entry. By the time they were age 85, 97% of the nuns whose entries contained the most positive wording and emotional content were still alive, versus 52% of the least positive nuns. And similarly, at age 93, 52% of the cheerful entrants were still alive versus 18% of the least cheerful. This research suggests that having a positive mental outlook could actually add up to 10 years to your life, and they'd be more enjoyable years too. In his book, Flourish, Martin Seligman says that his research estimates that being in the upper quartile of optimism seems to have a beneficial effect on cardiovascular risk roughly equivalent to not smoking 2 packs of cigarettes a day. In his book, Brain Energy, Chris Palmer states that all mental disorders, even mild or common ones, are associated with shortened lifespans. Men lose 10 years on average, and women lose 7 years on average of lifespan if they have any mental disorder at all. Not just serious ones, but even super common ones like generalized anxiety and attention deficit disorder. I think we all tend to think of our disposition, like that of the cheerful nuns, as pretty different from our structural cellular functionality, like in somebody with Alzheimer's or schizophrenia. And to a certain extent they are, but they might be more interrelated than we tend to think. I don't think we're super surprised to learn that positive people tend to live longer. Were you shocked to hear about the nuns? Probably not. What about the health span and lifespan of people with mental diagnoses of any kind? People with mental health challenges of any kind age prematurely, have shorter telomeres, and typically die from heart attacks, strokes, and diabetes, but earlier than people without mental diagnoses. Why? Could it have something to do with the fact that obesity, diabetes, heart disease, smoking, high blood pressure, high cholesterol, and lack of exercise all increase the risk of developing mental disorders like Alzheimer's and depression? And depression doubles your risk for Alzheimer's. Those with schizophrenia are 20 times more likely to get Alzheimer's. But mental disorders are likewise correlated with heart attacks, strokes, diabetes, obesity, and the like. It all goes together and definitely makes it impossible to tell which one is the chicken and which one is the egg. So much can be done with mind management and learning to change your paradigm and outlook. So keep doing that important work. Meditate, practice your 5 levels of gratitude, get coached, do volunteer work, all the things. I love them all. I'm sure you've heard the Byron Katie lesson about having your experience of watching a movie ruined by a big blotch on the screen. You go up and try to rub the giant blob off the screen. It's not working. You put in all your effort until you're tired and you're rubbing a hole in the screen. But it'll never work because the problem isn't with the screen or the movie, even though it seems like it is. There's a little bit of lint on the projector lens. Make sure you have a clear projector and you can finally see the story for what it really is and stop wasting your efforts on problems that aren't really a problem. We know this. It's such good stuff. Is it enough to fill everyone with boundless bucketfuls of mental energy and clear direction? Maybe, but it's a lot harder when your little subcellular energy factories are browning out, or worse. I read the book Brain Energy by Chris Palmer as soon as it came out at the tail end of 2022, and I've been wanting to do an episode about it for like a whole year. If you know anyone with mental illness, I think it's a must read. This includes schizophrenia, autism, Alzheimer's disease, depression, PTSD, anxiety, bulimia, you name it. I think it's also important if you want to decrease your chance of developing one of those yourself. I want you to be a powerhouse for the next 40 years of your life, and it'll be much harder to do that if your mental energy is flagging. The book Brain Energy is basically a defense of Dr. Palmer's theory that all mental diseases, no matter how mild or how severe, are metabolic disorders of the brain. The Merriam-Webster definition of a disease is a disorder of structure or function in a human, animal, or plant, especially one that has known cause and distinctive group of symptoms, signs, or anatomical changes. The definition of a syndrome is a group of signs and symptoms that occur together and characterize a particular abnormality or condition. The cause of syndromes are not yet known, but the signs and symptoms typically occur together. Chris Palmer says, most people think of common diagnoses like anxiety and depression as completely separate from serious mental diseases like schizophrenia. And he also says, in psychiatry, every diagnosis is a syndrome. And mental disorders are not distinct entities, including depression, anxiety, PTSD, OCD, ADHD, alcoholism, opioid addiction, eating disorders, autism, bipolar disorders, and schizophrenia. They are all metabolic disorders of the brain. Mitochondria can explain all the symptoms of every mental illness. Treating them this way leads to long-term healing as opposed to just symptom reduction. End quote. Pretty bold statement, right? Every single mental disorder is a syndrome, not a distinct disease, can be cured via fixing mitochondria, and all we're doing right now is reducing some symptoms with some medications that sometimes work on a short-term basis. Dr. Palmer says that serious mental illnesses are up by 21% from 2008 to 2017, except among those aged 18 to 25. Among young adults, their rate doubled. In 2000, doesn't seem like that long ago to me, autism affected 1 in 150 children in the US. By 2014, it's 1 in 59. Bipolar disorder has increased by about 4 times since the 1970s. 50% of all Americans will meet the criteria for a mental disorder at some point in their life. Rates of ADHD are up 41% in kids ages 4 through 17 from 2003 to 2012. Kids ages 12 to 17 had a 68% increase in depression from 2006 to 2017. Suicide rates are rising among most age groups. There are lots of theories as to why: pharmaceutical companies, laziness, helicopter parents, technology addiction, toxins, and fake food. They can all be true to the extent that they can all poison your mitochondria, except for maybe helicopter parents, but I bet there's probably some kind of connection there too. Dr. Tom Insel, the former director of the National Institute of Mental Health, NIMH, said in 2017 after leaving the NIMH, "I spent 13 years at NIMH really pushing on the neuroscience and genetics of mental disorders. And when I look back on that, I realize that while I think I succeeded at getting lots of really cool papers published by cool scientists at fairly large costs, I think about $20 billion, I don't think we moved the needle in reducing suicide, reducing hospitalizations, or improving recovery for the tens of millions of people who have mental illness." End quote. 90% of people treated traditionally for depression are not cured of their depression. 2/3 never even get to remission. Most patients with any kind of mental disorder are told it's a lifelong disorder and that they will need to lower their expectations about what they will be able to achieve in life. There aren't treatments that really work. That is so disheartening. Half of people with any mental disorder have more than one. Could it be because these awesome people aren't unlucky recipients of more than one disease, but just someone exhibiting different symptoms of the same condition? The disease of mitochondrial dysfunction in the brain. It raises questions about our diagnostic labels and whether they help empower patients or not. It can also help explain how there can be a spectrum of symptom types and degree of severity from very mild to completely debilitating. While we usually think of mental illness as very different from cardiovascular or endocrine diseases, they're very highly correlated. Chicken and egg, remember? People with serious mental illnesses are 3 times more likely to be obese. People with ADHD who are treated with appetite suppressants, called stimulants like Adderall and Ritalin, are still more likely to be obese than people without ADHD. People who are obese are 25% more likely to get depression, anxiety, and 50% more likely to get bipolar disorder. Weight gain around the time of puberty is associated with a 4-fold increase in the risk of depression by age 24. Likewise, traditional metabolic diseases like type 2 diabetes increase the risk of mental disorders, but also other illnesses not viewed as metabolic, like liver problems, kidney problems, nerve problems, hormonal problems, joint problems, tendon strength problems, gastrointestinal problems, autoimmune problems, and cancer. Metabolic disorders of the body are not completely separate from metabolic disorders of the brain. They're not really separate at all. When your cells struggle to produce the energy you need to thrive, any of your body systems can be affected. I don't think anyone quite knows yet why some people develop plaque in their arteries and some have chronic fatigue, some tear their bicep, some have incessant hunger, and some get anxiety or depression. But they're all a symptom of the same thing: suboptimal mitochondrial function, aka metabolic dysfunction. It's the same thing. So why do I want you to care about this? Because it's so cool. We've been bumbling along, doing the best we can with medications that alter neurotransmitter reuptake or whatever, hoping to lessen these truly troubling symptoms without much success. And now we have a whole new perspective. Maybe we've been scrubbing the screen and we finally found the dust on the projector. It's a little tiny mitochondria. I also think it's cool because optimizing metabolism and mitochondrial function can help with both major mental illnesses and our general disposition and perspective. We can be more effective in the work we're here on Earth to do if we have a positive outlook, can think clearly, can get into deep concentration, and can see things for what they really are. It takes mind management techniques and physiological cellular energy production. The side effects of optimizing your mitochondrial function for mental health, which is the same thing as being metabolically healthy, are decreased risk of cardiovascular disease, type 2 diabetes, cancer, chronic pain, etc., which means more years lived in good health, physical and mental. Your metabolism affects the structure and function of all of the cells in your body. Regulators of metabolism include several things like epigenetics, hormones, neurotransmitters, and inflammation. Mitochondria are the master regulators of metabolism. Each human cell has an average of 300 to 400 mitochondria, except for red blood cells. There are about 10 million billion mitochondria in your body. It was recently discovered that mitochondria move around, and if they aren't there when something needs to happen in a cell, stuff gets backed up. Energy and mitochondria are required both to turn cells on and to turn them off. Both things require energy. This is huge in mental illness. Mitochondria also communicate with one another, possibly via peptides. Mitochondria help produce, secrete, and regulate neurotransmitters. The signal to release neurotransmitters depends on the resting membrane potential and calcium levels of the cell. If mitochondria aren't at full power, neurotransmitters get imbalanced. This is a huge part of mental illness. Mitochondria regulate immune responses and stress responses. The enzymes required for the production of cortisol, estrogen, and testosterone are found only in mitochondria. They are the primary regulators of epigenetics, fat storage, eating behavior, and obesity. Underactivity of brain regions can be caused by dysfunctional mitochondria and result in memory problems, ADHD, depression, and trouble regulating emotions. Overactivity of brain activity can also be caused by dysfunctional mitochondria because remember, it takes energy to turn things off too. Overactivity can result in anxiety, obsessions, pain, fear, compulsions, and delusions. So what are some ways to improve your metabolic health? There are a lot. We talked about some of them in episode 15, Love Your Mitochondria, and episode 90, What Does Metabolic Health Mean? So those are some good ones to go back and listen to get some ideas. It's so important to your longevity to focus on your metabolic health, both for your physical body, neck down, and for your mental health. In the book, The Happiness Diet by Tyler Graham and Drew Ramsey, it says, a large study recently published in the British Journal of Psychiatry found that eating processed foods such as refined carbohydrates, sweets, and processed meats increase the risk of depression by about 60%. Eating a whole food diet, on the other hand, decreases the risk of disease by about 26%. Doing the work to figure out a way to love reducing your consumption of highly processed foods consistently does wonders for your mitochondria. And it's easy to say it, but to actually figure out how to do it in your life makes all the difference. In her book, Positive Psychology and the Body, Dr. Kate Heffron says, overall, our sugar consumption per year has risen from 5 pounds per person in the year 1700 to 152 pounds per person in the year 2000. Recent research has found evidence that sugar can have deleterious effects on our brain. Sugar has been found to shrink brain areas responsible for important functions such as memory and mood regulation. Westover and Mangrill conducted a cross-national study in Korea, USA, France, Germany, Canada, and New Zealand on the relationship between sugar consumption and the incidence of major depression. They found that there was a highly significant correlation between sugar consumption and the annual rate of depression. While this study has some major limitations, it highlights the importance of reassessing the manufacturing of processed food and the role of sugar in our diets. End quote. Doing the work to figure out a way to love reducing your consumption of sugar consistently does wonders for your mitochondria. Studies also show that exercise promotes positive mood and decreases risk of mental illness, obesity, cardiovascular disease, coronary heart disease, stroke, diabetes, osteoporosis, sleep disorders, high blood pressure, colon cancer, breast cancer, rectal cancer, lung cancer, prostate cancer, and endometrial cancer. Whew. Exercise puts more years lived in good health into your life while producing positive emotions, self-esteem, positive body image, improved cognitive functioning, psychological well-being, post-traumatic growth, flow, purpose in life, and so much more. Doing the work to figure out a way to love moving your body in whatever way feels best to you consistently does wonders for your mitochondria. There is one thing that is highly, highly correlated with weight gain, cardiovascular disease, cancer, chronic pain, chronic fatigue, attention deficit, poor productivity, poor decision-making, depression, and even hallucinations. Do you know what it is? Yes, sleep deprivation. We talked all about this in episode 49, Sleep is Not a Pillar of Health. In that episode, we learned that the majority of the population are sleep deprived and needlessly struggling through their daily lives. Matthew Walker says it's like we're all trying to boil water with the burner on medium heat. If we just slept a little bit more, it's like turning the burner up to high. We get so much more done in so much less time, and it feels easier and more fun. Sleep is not a pillar of health. It's the foundation on which all of the other pillars of health rest. Doing the work to figure out a way to love prioritizing sleep over entertainment consistently does wonders for your mitochondria. In Brain Energy, the book, Chris Palmer says, cells need energy to work. Metabolic problems are not simple or avoidable through sheer willpower. Metabolism influences every aspect of the way our bodies function. Our metabolism determines our cellular health, how our bodies and brains develop and function, and how we allocate resources to different cells at different times to optimize our survival. Some cells grow and thrive, and others shrivel up and die. It's a resource management system. Thus, our metabolism is constantly changing to keep up with the shifts around us. These adaptations in metabolism allow us to thrive in optimal environments or to simply survive in situations that are stressful to the body. Food scarcity, psychological stress, light exposure, temperature, how much sleep we get, hormone levels, and the amount of oxygen available to the cells all affect metabolism. Metabolism is the body's battle to stay alive. It's how we create and use energy. Problems with metabolism lead to problems in the way cells function. This is true for all cells in our entire body." End quote. The treatments he suggests for mental disorders are to 1. Remove or reduce things that are dysregulating mitochondria, which could be poor diet, poor sleep, alcohol, drugs, medications, and psychological stressors. 2. Correct metabolic imbalances such as hormonal or neurotransmitter imbalances. And 3. Employ treatments that improve metabolism like those that promote mitochondrial biogenesis, mitophagy, and autophagy. If you're interested in learning more and trying to reconcile the chemical imbalance theory of mental illness and some of the other postulated causes of mental illness with his new theory of metabolic dysfunction, I would highly, highly recommend his book, Brain Energy. If you need some help and accountability getting a 100% consistent, loving, living, and intelligent plan that optimizes your metabolic health, send me a message at healthcouragecollective@gmail.com or go to my website and click Work With Me or Contact Me. I'd love to get you excited about putting more life into your next 40 years, because it's possible. In the book, Dr. Palmer makes the point that mental illness is a global health emergency and the people often suffer alone in silence. They're ashamed, they feel weak or inferior, and they don't know what to do about their symptoms. They think their suffering is a permanent part of their existence. He envisions a world where instead of a patient visiting their cardiologist for their heart medicine, an endocrinologist for their diabetes medication, a psychiatrist for their bipolar medicine, they are able to treat or prevent all of these conditions with one integrated plan. I think it's beautiful. I am 1,001% on board. It'll probably be a while until mainstream medicine gets set up that way. So for now, you kind of need to take the reins yourself. That's okay. With a little help, you can do it. I would love to be on your advisory board, but mostly I just want to see you thrive however you get there. In her book, Kate Heffron says, one of the greatest findings of the past 20 years is that through effort and experience, the brain can change. That's exciting. Thank you so much for being here today. I hope you've seen how your mental health is more than just the presence or absence of a diagnosis label and how tightly it's correlated to your metabolic or mitochondrial health. When all of your cells, including your brain cells, can make enough energy, It's way easier to be successful with your high-performance mind management techniques and way less of a struggle to create the future that you want. Next week, we're going to talk about the most important part of your morning routine. Until then, unleash the power of your brain energy and don't be normal. Thank you so much for tuning into the Health Courage Collective podcast. I am truly honored that you have paid me the enormous compliment of your time and attention. I would be so grateful if you would share this podcast with someone you know and subscribe so you never miss an episode. This podcast is for entertainment and information purposes only. Statements and views on this podcast are not medical advice. This podcast, including Christina Hackett and producers, disclaim responsibility for any possible adverse events by use of information contained herein. If you think you have a medical problem, consult a licensed physician.
Fentanyl. It could be hiding anywhere, including in your house, including in your medicine cabinet, or maybe at a friend's house when you're hanging out, playing games, and get offered a pill. Don't take chances. If a drug didn't come from a pharmacy directly to you, you can find fentanyl using a simple strip you can pick up at your local pharmacy. Don't take it until you test it, because fentanyl can be hiding anywhere. Brought to you by the Georgia Department of Behavioral Health and Mental Disabilities.